a hands-on session, several of the stations, as well as certain discussions about emergent obstetric conditions which you will encounter in the labor room. So, Shreya, what is your one take-home point that you would want to take home from this DLSO session today?
How to do maternal resuscitation, which we haven't done before.
Yes.
You know, with the uterine tilt.
So, maternal resuscitation, where the most important point is the left uterine displacement, as you were saying. Why do you think it is important that we displace the uterus to the left?
So that the IVC return is that.
Yeah, so there is an effective
increase in cardiac output.
Okay. What about you, Kritika? How did you feel this session was for you?
The verbal communication with the whole team was very useful, and that is where actually everybody should be moving
focusing on. And also when you talk about communication, as I was stressing, the closed loop communication, that is very important. So when you want some action done, when it's an emergency, you name the individual, you ask her for that particular work that you want her to do, that role that you want her to do, you assign the roles correctly and you get the feedback from them. So when the loop is closed, the team functions more effectively. That is something that you all should realize and you should start practicing inherently from now. Not just a open call out to somebody saying you do this, you do that. What about you, Moshika? What did you feel was...
As a senior labor PG, we always had doubts about delivering a malpresentation mom, but I felt I got confident about breech deliveries after today's session.
Yes. So, breech is something that, as you all know, that almost always it's a 100% elective cesarean. And even if she comes in labor, it's an emergency cesarean. But in the event that you are faced with a breech, a favorable breech, as Madam was running through all the points, everything is favorable and breech almost on the perineum, then you know how to do your maneuvers and conduct a assisted breech deliveries. So when you keep running those movements and maneuvers in your mind, it will definitely be helpful. The most important thing is not to panic. You see the breech at the perineum, do not panic. Okay.
The mnemonics will also help you. What was the mnemonic we used for breech?
Careful.
Careful.
You expand on careful, or what do you want to say, Ishisa?
Earlier on we had a run on shoulder dystocia. So now we know not to panic and work in a timely manner and know what is to be done, anticipate it and be prepared enough for it.
Yes, for shoulder dystocia, yes, it's something that you panic and inadvertently give undue axial traction on the neck of the baby. And another very important thing is you know that you have the maneuvers to go through and you have to have a scribe to keep scribing and giving you time. So you know that yes, you have done 30 seconds, you move on to the next step. And as you said, the initial, in most, almost 70 to 80% of the patients, 80% with your two major maneuvers of the macrobus, with the pressure itself, you will be able to deliver that. The most important is you don't apply too much traction on the fetus.
And here also, which mnemonic would you use?
What is the mnemonic?
Helper.
Okay. So keep running those mnemonics in your mind. Okay. So you know it is careful for breech, it is helper for shoulder dystocia. So keep expanding it in your mind, and when you keep recapitulating it, you will definitely benefit from that.
I think they enjoyed the course overall.
Yes.
They had a good time.
Anything you'd like to add, Ritika?
In the goal, it was very effective, like all the maneuvers.
So what is emphasized? It's a teamwork always, right?
Obstetrics is always teamwork. No one obstetrician can conduct, especially so when it is an emergency situation. Okay?
Thank you.